Hello, my name is Rosalind Person, and this video will focus on remote collaboration with evidence-based care. In an evidence-based study done over 10-year span, determined that telehealth has improved quality of life with lesser deterioration of lung function and increased adherence to home therapy. The consistent support that patients receive through telemedicine has motivated them to be more compliant in their healthcare regimen. Has resulted in less visits to the hospital and decreased costs in hospitalization and invasive procedures. Pediatric respiratory reviews discussed in a recent study completed in 2014 that discussed that the use of video and audio connections between patients, caregivers, and collaborative healthcare providers has helped create remote patient-centered clinical services for cystic fibrosis patients. Telehealth offers better access to services, addresses early intervention, and improved monitoring. Telemedicine is useful in this case we will be discussing today because of the remote location of the patient with limited access to healthcare services in their area for routine visits, acute care needs, and emergencies. Assisting the family to provide interventions in the home will reduce the need for frequent visits. This is also a benefit since both caregivers work very long hours and have limited time to travel long distances for appointments. A brief background on the patient we will be discussing. Caitlin is a 2-year-old and was admitted for her second bout of pneumonia in the past 6 months. She has a history of bowel obstruction, is slightly underweight. During this admission, she was recently diagnosed with cystic fibrosis. She will need extensive home care services and follow-up due to the parents' limited experience with a chronically ill child. We are going to discuss evidence-based care and a care plan to assist in the care and support the family will be needing long term. Caitlin will be going home with a telemonitor setup to assist with video conferences with a collaborative team of healthcare providers at the hospital to assist with care. She will have monthly visits with her primary care physician and respiratory therapy initially, as well as home care services. Doctors' visits will be collaborative to include all disciplines via teleconference by phone or video in order to reduce visits and extra travel for the family or time off of work. Saturday appointments have been arranged. Until all care providers are educated on consistent care needed, a home care nurse will come into the home 3 days a week to assist with care and report concerns as needed. Patient teaching will be scheduled for both parents to make sure they have a clear understanding of her chronic condition. A need for telemedicine methods to be used for Caitlin is very important and dramatically needed for her health maintenance. Due to their remote location and limited medical resources, they need support in between routine doctor visits. It is important for the family to provide the best care with assistance without having to make several trips over an hour away that are not needed with their long work hours. As a study discussed in communication management with information technology, clear benefits of improved monitoring and support for self-management with virtual clinics and assistance with real-time application of the treatment plan. In other studies done by pediatric respiratory reviews, the home care was used as a tool specifically for CF patients in an attempt to reduce hospital admissions and increase stability. Over a period of 4 years, the study investigated benefits to clinicians and patients and the effective use of telemedicine, which has not been specifically reported before. I'm going to discuss the strategy of collaborative care plan that will be suggested. Due to limited access to health care, Home care nursing will be implemented to assess the care of Caitlin and report findings in between visits to monitor consistency of care. Due to the bruising caused by the mom's airway clearance therapy of chest wall compressions, a vest will be used to assist. That has already been ordered, and the home care nurse will bring out on the next visit and do patient teaching as well as step-by-step methods on how things should be set up and how often it should be used. Patient teaching by the nurse will be done with both parents, as well as it will be a recorded video so they can continue to watch as needed. Effectiveness of the vest will be monitored by system measurements and adjusted accordingly. According to studies, determining factors can influence the effectiveness of the vest to improve baseline lung function. This will help in reducing mom's anxiety and believing that she is doing something wrong or that she is not being effective in her care. Children's Research Institute explains that there is no one regimen for all patients, and an effective care plan is patient-centered in order to be successful. Continuous, consistent care and medical support is needed for successful outcomes and reduce pulmonary exacerbation episodes. Telemedicine will be effective in this process in management of her newly diagnosed CF, cystic fibrosis. Mobile labs will be able to come out to the home to draw the needed labs to have the results processed and sent to all disciplines. Home care nurses will be trained to draw labs during their visits when acute needs arise. Home care nursing will also continue to do patient teaching with bi-weekly consults via teleconference, by video or phone to discuss nutritional needs to prevent gastrointestinal manifestations of CF. A study done by Sabharwal discusses how critical it is to have a better understanding of how nutrition plays a part in maintaining proper care of CF patients. Home care conferences will also include nutritionists to teach on signs and symptoms of bowel obstruction, consistency of the bowel movements, and frequency and abdominal distension. The continued collaboration support will prove to be successful in Caitlin's care for successful management. All information will be kept in an electronic health record for up-to-date communication of her care. This will help collaboratively so the right hand basically knows what the left hand is doing. So her primary care physician, anytime she has emergency visits, so make sure that everyone knows in every up-to-date issue. So anytime she has to receive any type of care, whether acute, a chronic, or routine, it is updated in the chart regularly. So that way, any care provider is able to assess and see what has gone on since their last visit. Evidence-based practice models discussed the tools of telemedicine to bring collaborative results in providing efficient care to remote areas successfully. The most up-to-date evidence-based practice with the use of telemedical management is proven effective in CF management. Thank you.